Welcome back, everybody, to Conversations with Kush podcast. I am your host, Molly the Kush RN, and we are broadcasting live from V-Fest today in the beautiful St. Paul, Minnesota, right by Haley Q. Brown Center. We're out here till 6, so come on out. There's plenty of vendors, there's food. This festival is really in line with cannabis. I think it really supports wellness and health and fitness and spirituality and being aligned with our true selves and how we can be the most healthy in our life. Today I have a wonderful friend of mine, Sarah Slater. She is going to talk about cannabis and how it can support a child that may be neurodivergent or in some form or fashion on that spectrum. So welcome, Sarah.
Thank you.
Yeah, I appreciate you being here.
Of course.
Tell my audience a little bit about who you are and how you came to cannabis.
Yeah. So my name's Sarah Slater. I am a pediatric nurse practitioner here in Minnesota. Previously worked a lot with pediatric oncology patients, and that was when I started certifying patients for cannabis. And then realized that I had no idea, like, why does cannabis even work in the body? Like, what is it actually doing? There's, so many people claims that it helps so many things, but why?
You got curious then.
Yeah, so I got curious, dived into the education, and then opened my mind, and now I've just been obsessed with learning and educating others about it as much as I can, because there is a major gap between our traditional medicine structure and plant-based wellness, which includes cannabis.
Yeah, one of the things that I heard you say, and I think this is really important, is that you were certifying people in cannabis, but you couldn't educate them all the way through or take them on a journey as to like how to use cannabis in a really intentional way for themselves.
Yep.
So talk a little bit about how that's been going.
Yeah. So previously, the institution that I was working for, as I just said, I was certifying for medical cannabis, but I encountered a lot of conflict, and so I am no longer working there, and the conflict is all based on educating patients about where to find quality cannabis, how to actually use it. If you go to the dispensary and get a product, what are your options? How do you dose it? I mean, they meet these pharmacists and they're with them for however long the pharmacist consultation is, maybe an hour max, and then they move on.
I doubt if it's that long, honestly.
And then they don't speak to them again. They're just left hanging. And so I experienced a lot of conflict with trying to provide education for patients, and now I am branching out on my own and expanding my own services to offer primary care services for kids, so child checks, sick visits, both virtual and in-home. So I'm bringing the healthcare to them in their home. They don't have to go to the hospital. And that way, too, I'm not going to be silenced for talking about cannabis.
Right. What a disappointment, right?
Yeah.
Here we are trying to bring people the medicine that works for them, and it's getting shut down. So I'm really disappointed to hear that. I'm sorry that was done to you.
Thank you. And it's really mind-blowing because, yes, cannabis is legal both medically and recreationally. So then to learn that you really can't talk about it in these large health systems, I don't have words for it.
Right.
Yeah.
Well, let's dive into how cannabis can help kids that may be on neurodivergent spectrum, because I think especially when we're looking at the population of people that come to V-Fest, they're looking for like alternatives to big pharma, right?
Yeah.
So talk a little bit about how that can be helpful.
Yeah.
Cannabis can be helpful.
So for neurodivergence, and I tend to focus a lot on ADHD and autism because it's so prevalent, and apparently, statistically, there's more and more people impacted by these conditions every day. And so the studies prove, and it's without a doubt, that, let's say, children with autism or who are on the neurodivergent spectrum, they have lower levels of anandamide, one of your internal endocannabinoids that helps regulate the way you handle stress, the way you eat, the way you sleep. Just everything. And so I theorize that based off this science, that cannabis should be considered first-line therapy for autism if you're finding that you need help managing the behaviors. If you guys are managing with your support systems and everything you have, that's great. But if you're struggling, your child's not sleeping at night, maybe they have violent, self-aggressive or aggressive tendencies towards others, then I think cannabis is a wonderful place to start because it's going to target that endocannabinoid system specifically and help raise levels of their bliss hormones. So families will experience that their child's sleeping better at night, they're not as aggressive to themselves or others, and it can just be life-changing because when they're doing better, the whole family's doing better. So
it's once again just really looking at like that holistic person, right? We talked a little bit earlier with Jackie, and Jackie's take on cannabis was that if you can allow the endocannabinoid system to be working perfectly, either by supporting it through the things that you do like diet and exercise and health, or adding cannabis to that, the other body systems are going to fall in line. Right?
Exactly.
So, and we also, a lot of times that sleep especially is a byproduct of like those bigger things that are happening in our body, but very impactful, right?
Absolutely.
Like a lot of things that impact our health hinge on how well we are rested.
Yep.
So talk a little bit about like, to a person that's like, well, I don't want to give my kid weed.
Yeah.
What do you say to that?
Yeah.
Yeah.
I understand the concern.
Yeah.
Because we grew up, if we're alive today, we have experienced the stigma of cannabis.
Right.
And we don't want to get our kids high. We don't want to hurt them. We don't want to impair their brain development. So that's where I like to focus on all the studies that show these negative side effects. It's all geared towards THC or adolescents participating in adult use cannabis, which is not what we're recommending. We're talking about maybe using a full spectrum CBD product and figuring out how to dose it and find your child's own unique dose. And when you approach it by one cannabinoid at a time, like whether that's CBD or CBG, just do one at a time, you can learn what specifically works and doesn't work for your child and what their specific dose should be. There's so many different directions it can take, but it is very possible to make this safe, to do it without side effects, because if you experience a side effect, you just stop it or you back off, whereas other pharmaceuticals, you can't just stop. So there is, the low and slow approach is very useful to avoid the negative impacts, avoid getting your child high, all the things that we worry about as parents for our kids.
I've heard your talk on cannabis and neurodivergence before, and I think not only is dosing important to understand, but I think also timing of dose is very important, especially with neurodivergent people. I've worked with brain injured people, which is something different. I recognize that, but you can tell like the pattern of their day a lot of times will be like, they do better in the morning versus like, later in the afternoon, or maybe they don't do as well after a meal, or like they have they're very sleepy after a meal or something like that. So I think the timing of the dosing is very important. So
it is.
Talk about how you would work with a patient to help navigate the cannabis journey.
Yeah. So I believe in journaling everything when you're starting out on a cannabis journey, especially for a child, because improvements might be really subtle, or maybe even negative side effects might be subtle. But if you are keeping track of what time the cannabis was given and at what dose, then you might see that, hey, his mood is a little bit better, but then I noticed by the time it's 3 p.m. and they took a morning dose, we're back to being super chaotic and dysregulated again. So that's probably telling you that maybe it's a 8-ish hour window. And once you start tracking and picking up on those trends, then you can specifically determine, maybe I'm gonna move the dose to 1 o'clock instead of waiting for 3, so now your child is still able to self-regulate later.
Or maybe give another dose.
Yeah. Or give another dose, or whatever your needs are. If it's sleep difficulties, time it more before bed. If your child's too tired waking up, then maybe let's time it a little earlier, reduce the dose. Maybe we need to add more CBD if it's a THC heavy product. Like, it can get kind of complex, and that's where the journaling and tracking symptoms and your experiences throughout the day is really important.
What's like one good takeaway that you would tell a family, that you would tell them when they want to start with trying to use cannabis versus pharmacological aspects of the child's wellness?
Yeah. So I feel like my statements would change depending on what exactly we're trying to fix.
So everyone's different, right?
Yeah, everyone's different. So how someone's child responded to it does not mean yours is going to have the exact same experience. But I think the biggest thing is that I want people to know that it's safe, and you can make it so specific to your child, and to know that you're also treating this underlying system in their body. Like, I like to think of the endocannabinoid system almost like as a spider net, and all the other systems are trapped within it. And so if we can get the endocannabinoid system working right, then it better supports all the other systems. And most pharmaceuticals aren't going to do that. So I guess my message is to know that there is a safe way to do it with limited side effects and decreased potential long-term impacts. Yeah.
And make sure you're working with a professional.
Yeah,
right?
You can work with a professional like me.
Awesome. Is there any other takeaways that you want to let my audience in on? Any pearls if they're wanting to go down this journey?
I say the biggest pearl is knowing how to find a safe product.
Great.
A safe quality product that's actually gonna work. Because
and how do you find that?
So understanding certificates of analysis, and I think honestly connecting with other people who have found brands that work well. But the certificate of analysis and learning how to interpret it is going to be your biggest way to find a good. But there's obviously, there's some nuances to the certificates of analysis, but some companies are more reputable than others.
Sure.
Yeah.
Are there any communities that you can help the audience tap into that are doing a really good job with helping their kids being supportive with cannabis and neurodivergence, or any resources?
I know there are.
Okay. We can maybe link those to the show.
Yeah.
Let's link those to the show, because I think that's really important. I think sometimes people feel alone, and then they're scared to talk about it, right?
Well, I know, okay, so one community, it's, was it Whole Access Plants for Autism, WAP4A.
Okay.
I'm saying it, I'm twisting it up, but this is a whole community about parents who are using cannabis to treat their child with autism. And so they have Facebook groups and other groups and just all over. And these moms are very well educated through their own trial and error. So that's one. But I think, especially in the pediatric world, a lot of these communities are up and coming as people connect with each other.
One thing that I just really want to drive home today is making sure that you are talking about the stuff with your doctor. And if your doctor or your provider is not supportive of it, find someone that is, okay? Because cannabis is a legitimate source of medicine, and it needs to be an option for people, and people need to be educated about it. And so we need to start pushing these conversations so that doctors and providers are getting on board, right?
Absolutely. And if you have questions, you're more than welcome to reach out to me. My business is Balanced Canna Therapeutics, but I'm building it up now to Balanced Kids Health to be more encompassing for pediatric healthcare needs. And so I can help people with whatever they need, sick visits, pediatric wellness, cannabis.
Thank you for what you do in this space, Sarah. I just want to remind people that there are links to everyone's social sites and their websites. If they want more information from any of the guests that have been on today, you can click a QR code and go directly to those people's places where they can be found. So thank you again, Sarah, for your time. I appreciate it. Thank you everyone for tuning in at VFest. We are Conversations with Kush podcast, so make sure to check us out. Peace.